Hello, welcome everybody. Thanks for joining us for another Family Office Insights webinar. We're super happy to have Shraddha back, and for a second time, uh, we have a bunch of folks joining us today. So we know you're there. We can't hear or see you, but please post your questions to the Q&A or the chat box, and we'll get to as many as possible. We're super happy to again welcome Shraddha back and Astro Health. A fascinating business, and many of you will appreciate uh, hearing what you hear today. And also, if there's others that you think would benefit from it, we're going to be recording this, and you can share it with them, and we'll put you in direct contact with Shraddha post. Now, today we have a guest that's after Shraddha says hello is going to join us today, Bao Tran, who is not only an advisor but an investor in the company. Is that fair to say?
Yes.
And chat a little bit about why he's confident to vote with his checkbook, so to speak. So he's going to be able to share that today. So with that, please, Shraddha, take it away. Thanks for being here once again.
Thank you. Thanks, Arthur and team at Family Office and Insights. I really appreciate it. Having us here for the second time. I'm Dr. Shraddha Chaugule. I am the founder and chief outcome scientist at Astro Health. At Astro Health, we are focused on solving the most challenging problems facing health systems today. And we are building the world's first multi-agentic digital health AI platform that is clinically validated for stress, mental health, and substance use management. And before we dive into it, I would love to introduce our first investor and our patent attorney, Bao Tran. He is a partner at Tran VC. And yeah, Bao, please introduce yourself, and it'd be great if you could speak to a few words about, what interested you in our company. Yeah, thank you.
Well, thank you, Arthur and Shraddha, for
You're
asking me
welcome.
to be on the seminar. So my background is I was with Fish and Richardson, which is the biggest patent law firm in the U.S. In the year 2000. One of my client was Invisalign, and so we architected the initial patents, and then they got funding by Kleiner Perkins, and then they asked me to go in house to architect the rest of their patent portfolio, and then they went public in 2001, and then the rest of it is history. So after that, then I left the law firm practice. You enjoy the entrepreneurship experience so much that I specialize now in helping startup companies, and so that's one of the reasons we started Transformation Ventures Fund. And that the thesis behind that is we utilize IP as a moat to help companies succeed. These days in the AI companies world, you in before AI in the SaaS days, what you have, what was your moat was that you move quickly and you grow as fast as you can. Right now with AI, that situation has shifted. Vibe coding has now enabled competitors to clone you very quickly. Large companies, they can recruit even the founders away from the company. If you look at the Windsurf situation, right? So from an investor perspective, what we do is we say, hey, what is a sustainable, defensible moat that adds value to the company? And that's basically how we came in to help Shraddha and her teams is to build something that basically is a valuable asset that the investors can bank on regardless of what happens in the future. So I spoke to Shraddha about, I think, a month ago. We first met, and I was really impressed with her, in terms of her technical chops. She came out as a pharmacist, and now she migrated into the world of AI and how it's going to help the health professionals succeed in the age of AI. I myself have deep connections into the healthcare space, starting from my early experience. But we've introduced Shraddha to the people at HCA. Her first solution, is to help the overloaded and stressed out professional workforce at hospitals to to deal with the challenges facing their work. So based on that knowledge, and I saw what she was working on, I thought it was really a compelling proposition. So we built a patent that basically covered that particular work. And then we also just finished a new application on using her technology to help dementia patients. I've been interested in the space of helping elderlies navigate through the challenges of living, independent living, shall we say. And so I think dementia is a very important area of work that needs to be solved. And I'm very excited that Shraddha is addressing that need. And I think that's an important need. And that's why we're very excited to be a part of Shraddha's team. I hope she can say a little bit about how we move and how we help her move to the next phase. But that's basically, I think I don't want to take over too much. I can say more.
Thank you. Thanks, Bao, for the warm, introductions and for giving an overview about why IP is important in this era of AI, where it's easy to clone technologies and recruit even founders of startups with just money. So thank you so much. And Bao has been incredible partner an investor in our company. We were able to submit our first patent application for a multi-agentic clinically validated AI platform for stress, substance use management, and also improvement of human performance. And we are about to submit our second patent application. His wisdom and his business acumen has been very helpful for us, and we hope we can work with him throughout our company's progress. Yeah, thank you.
Well, thank you so much for that kind words. So it turns out that I have an interview with the patent office on yet another case. So I apologize for being very jumping in. I have to jump off to the patent office, but we've got to deal with those examiners. And so thank you so much. And if you have any questions, please feel free to reach me out. The website is tran.vc, and I'll be happy to answer any additional questions.
So, Bao, before you go, real quick, the clinical validation that Shraddha has, were you helpful in getting that orchestrated?
Oh, well, I can't claim that far. What I've done is connected to, Shraddha to HCA, which owns, I think, like 2,000 hospital complex chains. So that is an early connection. I think there's going to be a lot of work to go through, but as an investor, it's in my interest to kind of plug her company into my network as much as I can. We have connections into Stanford as well, the medical center, and I'm still trying to figure out who's the right IT person to connect Shraddha to them. But I do everything that we can as an investor to help her move ahead with a success in the project because we're aligned.
Exactly. Alignment's important, right? Incentives work. Yeah, perfect. Well, I super appreciate you being here. I know Shraddha does as well. So thanks for sharing all that with us. It's super helpful.
Well, thank you so much. And if you have any other questions, feel free to reach me out on LinkedIn or on email at the website, and I'll be happy to respond. So, all right. Well, very nice to meet everybody.
Okay, thank you.
I gotta go and deal with the patent office now.
Okay, thanks, Bao.
All right. Yep. I can speak to our clinical validation. I have a PhD in health economics, and this is what I did in the corporate world as well. So I worked in a digital health company, and I headed the health economics strategies for outside of US and US markets. And what it entails within the market access division is generating evidence needed for access into countries and health systems, hospital systems, insurance payers. And so I have deep expertise in this. So when Ian, our CTO, he developed the neural networks model to detect the onset of depression, anxiety, and mental health conditions, I was able to take that and submit it to the American Psychiatric Association. And I knew that because of the work and how advanced it is, we were able to get acceptance from them, and we were able to present that work in May of this year.
It's
So this,
kind of a big deal,
yeah,
right?
yeah,
I mean, it's like no small thing, right?
yes, yeah.
Yeah.
This is what I do in industry, and I completely understand that because companies raise like hundreds of millions of dollars in, like, their for their phase one or phase two study results or even design. And so we were able to do something similar with bootstrapping, and we were able to present that because of our in-house technical expertise. Yeah.
Yeah.
That's what's-
It's so I know you're going to get into it here, but then there's the next step that's allowed you to get into the hospitals, and then
Correct.
so let's go ahead and get into it.
Awesome. Thank you. Thanks everybody for joining us today. I really appreciate it. And Yep. So at Astro Health, we are focused on solving the most important problem facing US today, which is the problem of substance use disorder. And why it is important is because there are 40 million people suffering from substance use disorder in the US, but only 2.7 million people receiving treatment. So we already know that there is a problem with access to treatment in the US. And why it is so significant is because 82% of the prescribers for substance use are in urban areas. So there are hardly any prescribers in rural areas. And the time it takes people to get to the hospital where they can get Medicaid coverage is about 35 miles. So it's very inconvenient for these people with substance use disorder to seek treatment. And why I'm talking about Medicaid is because one third of the people in the US are on Medicaid right now. But even before we address this problem, we have to understand what is going on with people who are receiving treatment. So, one third of the people who are receiving treatment discontinue treatment, leading to relapse related hospitalizations, ER visits, and a huge burden on the US economy, which amounts to about $500 billion every year. So, we wanted to solve this problem as an outcomes scientist, and we realized that the way we can help people be adherent to treatment is to do remote patient monitoring and do it in a way which is very low touch point and still very effective, and then also provide treatment delivery to patients via telehealth. But we don't want to just treat the disorder. We also want to like attack the root cause of the disorder. And we have identified workplace stress to be a significant precursor for substance use. And when we looked into this problem, we realized that 85% of the US employees are are stressed out. Depending on the level of stress, of course, there's people who experience mild stress versus severe stress, and this costs the economy about $300 billion due to lost work productivity, absenteeism, and high turnover rate. So our solution is the world's first multi-agentic digital health AI platform for stress, mental health, and substance use support in real time. As Bao mentioned, it is patent pending. And I can explain how this is different. So there are current wearables in the market like Whoop and Apple iWatch and Aura Ring, and they detect your physiological biomarkers like sleep, footsteps, heart rate, and even screen time. And based on that, they develop algorithms telling you that you're stressed out. How do they detect this? So, if your heart rate is very high, they know that you're anxious or more stressed out. But there are confounding factors involved, and they have not been able to identify, if this is because of stress or because of high activity or high physical activity. And they just take you to the problem, which is stress, but they don't help you identify what is happening at the back end, or why you are stressed out, or why you are going into depression, or why you're about to have a relapse. And so our system is very different. It's because it's contextual. It takes into account not only your physiological biomarkers, but your environmental and personal stressors like your work stressors, social factors, your psychological capital, We have clinical assessments also integrated into the system. We have conversational AI via chatbot, and all of these are weighted to create a score, a stress score, a mental health score, which helps determine the onset of mental health conditions and substance use conditions. And in real time, we are able to provide support to these people. And these are really simple evidence based interventions. For example, if a person,
Shraddha, I realized the deck is not up. I didn't know whether you thought it was.
oh, it's not up.
Yeah, we see your lovely face in the place where the deck I thought was going to be. And I didn't realize, I thought you were going into a narrative. And then I said, hold on a second. There it
Okay,
is.
okay,
There it is. Okay. Now you can put it in
perfect.
presentation mode. That's right.
Yes,
You were making
perfect.
a lot of sense anyway.
That's totally fine, you know.
Yeah.
So yeah, so we have a um, very intelligent system here, but I can like I explained to you in very simple terms, it takes into account all the identifiable factors in a person's ecosystem, and it does that via wearables, mobile app, and also web application. And we may not have all of the factors for every single person, but over time we'll have enough data to kind of have a neuropsychological profile on that person. And our system not only helps you determine the or detect the onset of depression and substance use, but it helps you to identify what is causing that and helps you support in real time and improve that treatment adherence or adherence to just good behavior. And the way it is also different is we have human in loop. So we'll have a therapist and psychiatrist in loop. So this is not just AI. We will have like a human that oversees the interventions, and it's we have safeguards in place for that. And if we look at system level, how this is going to improve um, the lives of the patients and outcomes. So we have AI agents for real-time patient feedback to understand how the patient is doing. We have LLMs for real-time detection of harmful behavior, suicidal ideation, and we have deep neural networks to identify root cause detection and support in real time. And how this will impact outcomes. So, this real time patient monitoring will improve clinical outcomes by improving treatment adherence. So, we'll be able to keep patients in the treatment. And because of that, they will get better sooner and return to workforce and get to 100%. And so, there'll be healthcare cost savings, improved quality of life, greater work productivity, and less missed work days and less hospitalizations. So we have been recognized, our work has been recognized by the American Psychiatric Association. We presented the results from our real world evidence pipeline, and this pipeline or this data consisted results from data on 20,000 individuals. And of that, we had complete data on 4,000 individuals across 50 states. We had physiological biomarkers, healthcare utilization, and time they spent on yoga, meditation, physical activity. And then we had their work profile and missed work days. And we were able to detect the onset of mental health conditions with 90% accuracy. And that is what we presented at the American Psychiatric Association. And our neural networks architecture that has been accepted at ACAI IEEE conference, and we'll be presenting that on December 27th this year. So based on this, we were able to get a clinical study started at Los Angeles General Medical Center. It is part of the USC health system, which also has Children's Hospital Los Angeles, USC Norris Cancer Center, and Keck Hospital into the system. So we're just starting with Los Angeles General Medical Center. We submitted a clinical protocol. We have tentative IRB approval for it. And this we are doing with naval resident physicians. And the reason we are doing this is because we would like to have clinical outcomes data for access into hospital systems, not just for patients, but also for healthcare workers. We identified that burnout and stress is a very big problem with physicians. actually it's the number one problem because we are understaffed right now in all the developed economies. And because of physician burnout, you know, physicians tend to change job, and even resident physicians tend to drop out of their program. So we want to like have this beachhead population and integrate our system to help them with burnout management. And then for patients, we have advanced AI for real-time detection of harmful behavior and real-time patient feedback and other things. And then because these are neuro-resident physicians, these clinical outcomes, we can take it to DoD for access into that market. So yeah, so we are waiting for funding. And like I mentioned about this before, we have done real world validation, but that is one time point. So we had data from 2022 on 20,000 individuals. Out of that, we had data on 4,000, complete data on 4,000 individuals, and we have 90% accuracy with that. So now the pilot study for clinical outcomes is for real time data. So we're going to show in real time that we were able to help support burnout management and substance use
I
management.
guess one would argue that if you could be successful with one of the most stressful occupations and stressed out cohorts, that it's likely to be welcomed anywhere else.
Correct. That is, yes, especially in finance as well, right?
Yeah.
They're very stressed out, but clinically, this problem has been studied and identified in physicians and healthcare workers. So there is a plethora of literature, published literature, showing that, you know, burnout is number one problem. And right now, they're just dealing with it via check-ins with their preceptor, you know, like the resident physician residency program director, what she is. And they don't have any systems or processes in play. So this is a very, very big deal for them. And that's why Dr. Shi is very interested in this. And hopefully he'll be presenting and doing a session at AMC this year for physicians and residency directors from other hospital systems. So how it works at the top level, we have multimodal data capture, integrating physiological, psychological, environmental, and conversational data from wearables, mobile apps, clinical records. We have real-time processing of that data to identify the root cause. And then we have adaptive support for people and patients in real time that evolves with the person and the person's needs and dynamically supports that person. And then we plan to go into longevity, and I can speak to that in a few minutes. And then we have AI agents streamlined for real time patient feedback, reducing administrative burden from health systems. And that is a very big deal right now, especially in application of AI within health systems. Our investment highlights, we have technical and clinical validation. We have early clinical traction with our real world pipeline validation work presented at presented at American Psychiatric Association and our pilot program at Los Angeles General Medical Center. And then we have an academic partnership for AI research with Indiana University. And yeah, we are in talks with HCA, which is one of the biggest hospital chains in the US and UK. And we plan to present to them very soon. We have compelling economics, so we know that this is going to reduce cost per patient at least by $9,000 in substance use, looking at our competitors. And we will be able to help manage burnout. So we will be able to reduce turnover rate and missed work days. We have a huge market opportunity. These are very big unaddressed problems. We have IP moat, we have patent pending, and we have world-class team. It is me, our CTO, Ian Thorner. Ian is an AI engineer, and Ian does all the advanced AI work and analytics himself. We are looking for funding to do hiring for full stack and for implementation of our technology, which will include developers essentially. And then we have top-notch clinical and AI advisors right now. Dr. Eric Shi, who is the director of the residency program at USC and our principal investigator over there. And Dr. Christina Lerman, who is from Indiana University and very well known and published, researcher in her field. So this is our R&D portfolio. It's very, very exciting for me to share this with you. This is our AI-powered personalized dementia care support system. There are 55 million dementia patients in the world and 7 million Alzheimer's patients in the US. We all know a friend, a colleague, or even a grandparent, who is suffering from this problem. And the biggest problem in the US is caregivers burden because it costs about $400 billion to the economy. These people are not able to take care of themselves, and their functionality and independence reduces as the disease progresses. So what we are planning to do here is have, people who have a clinical predisposition or people who are at the onset, we do a neurodegeneration assessment using speech models, AI mobility visuospatial models, and understanding the clinical biomarkers and genetic predisposition for comorbidities and dementia. And then we have a neuropsychological profile on that person. So this can be done at physician's office. And then we have environmental sensors set up in the person's home, which help us identify the onset of neurodegeneration, specific aspects. And the person meets with a health advocate or via an telehealth system, depending on the progression of their condition. And then we help the person support and help the person manage their comorbidities and mental health conditions and cognitive impairment. We help them relearn lost information and help them, hold that glass of water and retrain them to do that and help them be independent for a longer period of time, improve speech, mobility, give them nutritional coaching. And for advanced care, as you can see here, we would have real-time monitoring to reduce falls and nurse staff burden. So this will really help people, quell their anxieties where their parent may be having dementia, and you can monitor your father or mother, and you are on the call if the sensors detect fall, you'll be immediately alerted.
It seems to me like the caregiver stress level is super high too, right?
Correct. It's
Yeah.
very high, and actually, it's a very big problem that's studied in outcomes research. So they not only study the impact on quality of life of the person or an individual, but also the caregiver in Alzheimer's, and it's enormous. It impacts their quality of life, the time they take out of work to support their loved one. It's enormous. Yeah. So you're absolutely right, Arthur. Yeah, and then we plan to do an R&D study at Los Angeles General Medical Center with patients. And we would have 13 patients. We would collect speech data, spatial body mapping data, brain scans, and clinical biomarkers to develop our neural models to assess neurodegeneration. For this system, we would also conduct focus group interviews in depth to understand the contextual experiences of people living with dementia and what sort of interventions will help improve their quality of life. And so this would be the first step, and this would have an FDA 510K approval path. So because we plan to have these advanced detection technologies integrated on our platform along with care support. So going back to our first platform, which is closer to market, our total addressable market for that is $800 billion with workplace stress support market plus the substance use market. And our serviceable, obtainable market is very niche, very targeted and focused. We are not looking at Medicaid, Medicare, where there are other variables involved right now with administration cutting down telehealth and Medicaid coverage for a lot of programs, will be focused on employer covered health insurance. And we are targeting a very beachhead population over there, focused on US employers, insurance and provider networks. And we have a near term penetration model as well for our SaaS adoption for the healthcare workers for burnout management. But our main target population is the patients.
Is it a workers' comp claim on some level?
That would go for disability,
Yeah,
right? So that would go into disability, and that would be for more severe cases, I think, when they go into behavioral health, taking time away. And I don't think this would come into workers' compensation. It would come for as just coverage,
yeah.
from my
Regular medical coverage, yeah.
coverage, exactly. For example, people deal with osteoporosis or people deal with cancer while working and
Yeah,
they go and get their chemo done. So they would get, so insurance take cares of all of that.
yeah,
But then if they are super ill, they have to take time off, medical leave, and then it goes into workers'
right.
compensation. So it's similarly, yeah. Hmm. So our model for our AI stress management platform, Burnout for healthcare workers and physicians, is subscription-based pricing platform plus dynamic pricing. It's intentionally very low cost, and for our B2B substance use treatment delivery model, it would be per user per service, employment covered treatment delivery, and it's platform plus value based. So right now what is happening with health systems is they just don't want to just pay insurance cover, they just don't want to just pay for any treatment delivery. They want to see that it is effective because they want to incentivize those treatment providers to do a better job. So we will have value based pricing, and we want to do that because we have that much confidence in our system that we'll be able to reduce costs. So that's going to be our strategy. For the investors, it is a money-making business and it is going to be profitable. Right away, year one, we would have break even. And our projected revenue, as you can see, is $6.8 million in 2026, $46 million in 2027, and it shoots up to $192 million in 2028. That is because we add on treatment delivery. So we want to go very, very strategically and in a very methodological way, where we first add patient treatment monitoring and then go into delivery because we would be integrating physicians and therapists into the system, and that involves a lot of capital investment. Our go-to-market strategy, employers, insurance, companies, and then health systems. For longevity, we would have hospitals and nursing homes, and then there would be a beachhead population where we would go direct to consumers who could afford to pay for the system.
Yeah,
This,
you might not need to do that because you'll probably exit before it.
I hope so. I
Yeah,
hope so.
I hope so too. Yeah.
Yeah, and then business roadmap. We are 2025. We were able to present at American Psychiatric Association, get our first pilot program started, submit the clinical, study protocol, get our IRB approval. We are now doing our late seed round for that. 2026, we want to start expanding into the enterprise market with our stress management platform for physicians and healthcare workers, and then start getting our first customers for substance use management. And then 2027, 28, we would be launching our longevity AI platform. And then finally, we plan to go into the government accounts, Medicaid, Medicare, NHS, has GBA, because it requires a lot of paperwork, a lot of other things, and we don't know if we have those codes for AI right now integrated into the system. They might have to start or create new ones. So substance use disorder management comparator analyses, we literally have one comparator offering a 360-degree digital virtual care clinic solution. And yeah, it does not need FDA approval because it's treatment delivery and more focused on treatment adherence. They don't have any AI personalization. They don't have real-time support. And so we have unique root cause detection, real-time support, and that is what separates us from them. And yeah, so it's a very underserved market right now. And if we look at head-to-head comparison, we have multimodal data capture, real-time monitoring, root cause detection, AI agents to reduce administrative burden, and then cross-market applicability because we would also go into burnout management for physicians. Um, or enterprise stress management. So these competitors, they do for US employers or employees. They're not focused specifically on burnout management for physicians and healthcare workers, but every single one of them is a unicorn. And they are technologically naive if we compare them, with us in terms of AI. Thrive Global works, in a way where they have behavioral economics integrated into the system for um, scheduling micro goals, and they have meditation, and they are low cost, and we are benchmarking our costs against them, and we are providing real-time support, and we are providing root cause detection. And then Modern Health has therapists integrated into the system, but that's about it. And BeWell has gamification integrated into the system. And we have all of this, and we are benchmarked against them where pricing is concerned for enterprises. Our
It's
investment
actually amazing that they're all three unicorns.
they're all three unicorns.
Mm.
So I think it's so underserved. The market is very underserved. It's a very big problem. We need more players into the market. And, that's why we are not even going and touching the US employees, like general US employees right now. We are focused on hospital system and, the surgeons, the nursing staff, the social workers and physicians, all of them right now, because they are very highly stressed. And our system is evidence based because we have shown in with our models that we are able to detect the onset. It's not just that we are telling them like any of these companies. I'm sure that they were able to show outcomes later on. So I know for sure Thrive Global was able to show decrease in turnover rate in call center employees at Microsoft. So they were able to show decrease in turnover rate, but we don't know if how effective it is in detecting any of this because they don't have those technologies integrated. So yeah, and we are not even going to that population yet. We're going to focus with health systems, and we can go. And I'm like, why not? So once we have the business development executives and other hiring done, we can easily go into that market. But right now, we want to like stick to patients and the healthcare providers.
Like I said, I don't know a lot about this, but it seems smart to me if you're addressing the highly stressed population in the healthcare system,
Yeah,
that it's a natural validation for the rest
yeah,
of the
yeah.
population, right?
You got it. Yep. Thanks, Arthur. Yeah, and our ask is $5 million for 18 months runway via YC Safes at 20% discount. This is a very, very small funding round for a company such as ours, and I can give you a benchmark. If you look at Hippocratic AI, they have advanced AI capabilities, and their seed round at A16Z was $50 million. And the last 2 years, they raised $400 million. And we have like 3x or 4x AI, advanced AI capabilities. And we are focused on really, really like substance use disorder management and mental health management for patients and burnout management. So you have, for investors, this is a great opportunity at a very early stage. And we are doing a very small round. So we are doing YC safes, but we are open to doing convertible notes. And so the ask is very small, so their equity, stake would be higher. And the reason we are able to do that is because we have in-house technical expertise. And as an economist, as a health economist, I don't believe in pumping in hundreds of millions of dollars without generating revenue or without having a clear strategy in place, especially if we are working with patients. So we want to be very conservative, ultra conservative with our funds. And this is just for two clinical programs, 50% of the ask. And then we want to do hiring 30%. And then founding team salaries 10%. And then we want to always work with academics and research institutes to advance our AI capabilities and have like good relationships with them. And so we want to allocate 10% of our funds for that. And then we are going and building our backbone, which we were able to do with our American Psychiatric Association conference presentation and now IEEE. And we will be doing that with our two clinical programs at Trauma One Center in Los Angeles, top of the notch, facility or hospital system. And once we do that, we'll build on that credibility, and that time will come, when we raise that money. But I wouldn't want to raise 50 million just because I can or I should be or other companies are doing. I just want to give investors that, ballpark and what people are doing right now.
Do you think that is likely to, that duration is likely to stick? In other words, you're going to maybe find out in 12 months that you need to do another raise?
Yes.
Yeah.
Um, because you want to move with the market. And
Right.
the problem that we are facing right now is everything is ready. We need the funding.
Yeah.
We can't go ahead or move ahead without funding. So the amount of work that we have been able to do with bootstrapping, it is about like $1.5 million worth of work, and it's not wise to start recruiting for a clinical study with IRB approval without fundraising. So we are just asking for basic funds to complete this study and do the necessary amount of hiring. And then we may have to raise money to expedite our scaling efforts, to match our competitors. But what I'm saying is because we are so conservative with our raise, we will be able to reach break even and achieve profitability sooner. And as an economist, I'm not impressed with valuations and the amount of raise they are doing. It also depends on how much cash they have on hand and how much revenue they are generating and how much profit they are making, because this is not Amazon, where they just invested billions of dollars and then they started making profits later on. This in healthcare, in medical devices, it's very different. And so it's credibility, credibility, credibility,
Mhm.
credibility with patients, credibility with physicians and health systems, showing outcomes and doing it the right way. And we want to do that way. Yeah.
That makes sense.
Thank you. Any other questions?
Uh, I'm good for right now, but I'm sure I have plenty. What do you think so up to this point, you haven't raised any money, right?
So we have with Bao, so he's our first
Oh,
investor.
right, right.
And then we have done, I have some angel money from family. So we have raised that way. And now we are getting significant investor interest. We have about like 10 investor meetings lined up. And so this is the stage, where we want to like close around and start our study recruiting from the beginning of Jan. Yeah.
Yeah. And also, I've heard that the physician's day is 50% consumed by uh, documenting their activity, right?
Yes, yes. There are like a couple of even unicorns in this space that just solve this one problem, you know. And we are able to solve this because we have a multi-agentic system. So one of our agents, that agent is built just for addressing or detecting patterns of distress and mental health conditions in real time, which is LLM based. But the other agent, it is like a live feedback agent. And so that would remove the first layer, human layer, contact layer. And so we expect that burden from the nursing staff or the social workers removed. And you're absolutely right. It's a huge burden on physicians. And as we advance, we would like to add more agents specifically targeting those problems. Yeah.
Totally makes sense. It's incredible how in 18 months we went from using AI in niche places with highly sophisticated developers that understood it to making it available to everybody.
Correct.
And everybody is writing AI agents to solve their own idiosyncratic problems.
Right.
But it
Right.
happens so fast.
Right. And that's why, when I designed the system, I didn't redesign, I was designing a multi-agentic system. And I came across Satyanarayana's interview, and he's like, when he spoke about it, I'm like, these are AI agents because they are autonomous, you know. And so our IP is not the AI agents that they solve incredible problems and they save a lot of money. Our IP is the entire system where we are able to assess neurodegeneration, for example, in our longevity platform, and then offer real-time support based on that assessment by agents and human in loop. And then we have another agent for real-time assessment. So it's the entire system with the feedback loop that we have, and that's what we are submitting the patent for. And that is so incredible about our system. But you're absolutely right. Like anybody can just take up OpenAI and create an agent, and it's become a commonality right now
Totally.
to create an agent. So what differentiates us is we are very evidence-based, and we are not an AI agent company. We are a system company, AI system company. It's a highly intelligent system, and it's the most advanced contextual system to date in the market. Because even if you look at any other agentic systems, they are not contextual enough, even though they say it's contextual. And because I'm a behavioral economist, I could integrate behavioral factors like your social factors, your environmental factors, your work stressors, your personal stressors. So it is as contextual as it can be, and it helps to assess all these areas of your life in the palm of your hand.
What's is it a process patent?
Yes, it is a process fat patent, and yeah, it's data integration process and system patent. Yeah.
How do you account for input manipulation? For example, if the patient has to put in certain inputs, their social environment, their work stressors,
Yeah, yeah.
and people lie, people cheat, they
Correct, correct.
stack things
Yeah,
and
yeah, 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 yeah.
yeah. So how do you account for that sort of thing?
Perfect. Thank you. Thanks for the answer. So, for our longevity platform, we have environmental stressors that would detect, falls, that would detect changes in your speech, changes in your mobility. So we have environmental stresses. So we also understand social interactions, how much time the person is spending on phone or social media. So we have other systems and processes in place along with um, the feedback from the individual. And you have to understand that these patients, if they're advanced or they've already started developing dementia, they're not going to remember incorporating all of these things.
Yeah.
So we have these environmental sensors in place for that precisely. For our stress management platform and for our substance use platform, um, we have mobile app and we have a web app, but we have variables as well, right? And so we would know if the variables are detecting 8 hours sleep and they're saying 10 hours. We know that.
Yeah.
But what I understand as a health economist and a behavioral economist is the other way around. So we, as clinicians and as a patient reported outcome scientist, we give more validity to self-reported responses than device perpetrated responses. And one of the reasons is that everybody's stress level is different. how I react to World War III is different from my brother reacting to World War III, or my
Yeah.
husband, or another person reacting. And so what you respond and how you respond determines your stress levels. And so we give more weight to what the person says than what in that scenario, in at least for stress and mental health. And that's why our system is not just a combination of, not just variables, but also um, self-reported responses, and with their feelings and what they think. And sometimes people may not give you that response, and that's totally fine, because over a long period of time you would have enough responses, long as even a week's time, to impute those missing values and still have a very robust model. And we have seen that, in our analyses. So yeah, that's, and also we incentivize them. So we have incentives where we have reward signals. So I don't want to talk in terms of engineering, but in lay terms, we reward people for their good behavior and their nudges. So if they are sleep deprived and the system recommends them a sleep hygiene, and for adhering to sleep hygiene, the person gets rewarded points, and they are able to redeem that in a marketplace for enterprise system with lifestyle items and fun items, or even some discount off some things that they want to like buy off Amazon. And for patients, we would have cash rewards the way enterprises have for employees for doing preventative checkups. They have cash rewards. So I think that works better for people. Yeah.
Yeah, super interesting. Uh, I'm anxious to see how it works in action, because I think I've said it 3 times during a conversation about incentives working. We just happen to know
Yeah.
that they do. Yeah.
Yeah.
So,
Thank
all
you.
right. So we've got $5 million. We've got 10 meetings set up for sure. Got lots of interest. Hopefully some of the people who see this in the Family Office Insights community or dialed into this type of opportunity will jump on and get an introduction to you. We'll make sure that happens.
Thank you, and Arthur. Thanks for having me here today. I really appreciate it. And thank you for the work you do to bring, small companies in front of investors, and giving them visibility. I really appreciate it, because as everybody knows, Arthur works with really big, companies like Mercury and founders of Reddit, and he gave us this opportunity for a small social impact company. So it means a lot, and we need more people like you today in
I
this world.
really appreciate the kind words, and we're
Yeah,
super happy to do it. And
thanks.
it won't be a small company for long, I don't think. So,
Okay.
yeah.
Thank you. Yeah, take
Okay.
care.
Thank you,
Yeah.
Shraddha. Thank you, everybody, for joining us today
Yeah.
and sharing with us the only thing you can't make more of, and that's your time. Till next time. Thank you, Shraddha. Okay.